Good afternoon, everyone. Welcome to Cancer Reach, a live session on breast cancer awareness. So, Cancer Reach is an initiative by Dr. Krishnamani to increase the awareness on cancer and also help patient and caregivers to access the right treatment and right time. So, Cancer Reach with have a great motive to create awareness and every month. So, we are going to have live sessions every month based on the awareness on that particular month. Dr. Krishnamani is a leading medical oncologist from Hyderabad, having more than 10 years of experience in treating various cancers. So, as you all aware, October is known as a breast cancer awareness month. So, breast cancer is one of the leading challenge that every woman is facing in the current scenario. So, Dr. Krishnamani is with us to enlighten us on some basic information and information related to the treatment going to share with us. Welcome to the live session, sir.
Good afternoon, everyone, and thank you for inviting me.
Doctor, request you to give your opening talk for this live session.
So, first of all, I would welcome you all to the live session. Cancer Reach is an initiative to spread awareness about cancer. The motto of Cancer Reach is cancer information reaching each and everyone. That's why we try to put out awareness videos, live sessions like this every Friday, so that we can reach maximum number of people who are, be it caregivers, be it the lay public, so that they can get information on cancer. And October being the Breast Cancer Awareness Month, we have dedicated 2 or 3 sessions on breast cancer, and this is the first session on breast cancer. So I hope this will be informative to the people who are watching this now or those who are watching the recorded session later.
Thank you, Doctor. Thank you very much for the great initiative to support everyone watching this live session. Doctor, while starting this session, I would like to ask a basic question to you. What is the breast cancer and how common it is in India?
Breast cancer is one of the most common cancers we see in the world today, and India is no exception. You can call it the most common cancer in women in India today, and one of the top 2 or 3 cancers in the country. So what is breast cancer? It's a cancer which starts in the breast or in the tissues of the breast. So it usually starts in the breast or the tissues of the breast, or sometimes what we call as axillary tail, that is close to the armpit. So a lump or a cancer which starts in any of these areas is, in a very simple way, known as breast cancer.
Doctor, how common this cancer in women?
So as I just said, it's the most common cancer in women in India. There was a time few years back when it was the second most common cancer in women, and cervical cancer was the most common cancer. And there was also a rural versus urban divide. In rural areas, due to lack of awareness, to lack of personal hygiene, or many other socio-economic factors, cervical cancer was number 1. And breast cancer was considered as a disease of the urban women. So in urban areas, breast cancer was number 1, or it was the most common cancer. But now that divide is more or less getting almost similar. There is no divide right now. So now breast cancer is the commonest cancer we see in our women. And it is also probably because of the changing times, better socioeconomic factors, more urbanization, and all those kinds of things, which has increased awareness too, and obviously the increased incidence of the disease also, because of which breast cancer is the most common cancer today, which we see.
Doctor, what are the risk factors that cause breast cancer?
So for breast cancer, like any other cancer, age is an important risk factor. So with increasing age, there's an increased chance in getting breast cancer. So it is commonly mentioned that women above the age of 50 are at a higher risk for breast cancer. That may be true, but doesn't mean that women below 50 don't have a risk. We see a lot of women in their 30s and their 40s, especially in India. In India, we see a lot of young women who have breast cancer. So one of the risk factors is age, increasing age, is an increasing risk of breast cancer, like most cancers, but breast cancer is also seen in the young. Early menarche, late menopause. These are two risk factors. What this means is that menstruation for a woman starts early and the reproductive age is a longer duration. That is, they have a very late menopause. So they have been exposed to hormones for a very long period, endogenous hormones, we call them. Then those women who have an early menarche and a late menopause, that's a risk factor for breast cancer. Nulliparity, that is not having childbirth, so not bearing children, is a risk factor. Because what happens is when you're pregnant, certain changes happen in your body. And because of these hormonal changes, the risk of breast cancer decreases. Women who do not breastfeed their children, they are at higher risk of breast cancer. Other important factors are alcoholism. Women who smoke, women who drink alcohol are at a higher risk of breast cancer. Genetic risks. Close to 10 to 15% of breast cancers could be genetic. That is, they could run in the families. These women probably have a mutation called BRCA1, BRCA2, which we call BRCA1, BRCA2. They have a risk for other cancers like ovarian cancer. Genetic risk is a risk factor. Another important risk factor is postmenopausal women who take hormone therapy. Those women who take hormone therapy have a risk of breast cancer. So to summarize, increasing age, early menarche or period starting at a very early age, late menopause, then women who do not breastfeed, women who don't become pregnant, nulliparity, genetic risk factors in 10 to 15% of women, postmenopausal hormone replacement therapy, obesity, smoking, and alcohol are some of the common risk factors. Now, you would divide these risk factors as those which you can modify and which you cannot modify. What can you modify? You can modify smoking, stop alcohol, have a good physical activity so that you are not obese, do not take hormone pills. So these are all the modifiable factors. Age and other, breastfeeding obviously is a modifiable factor. But other factors like age, early menarche, late menopause are unfortunately non-modifiable risk factors for breast cancer.
Doctor, as you explained, breast cancer happens in women. Do this breast cancer also happen in men?
Yes, very much. So when we talk about breast cancer, we only talk about women or we predominantly talk about women. But let us understand that men also can develop breast cancer. See, breast is basically a tissue, that's all. And that tissue is present in men too, and men also can develop breast cancer. But the risk is very, very small. So, men developing breast cancer is less than maybe 1% of the total number. But men do develop breast cancer. And if men develop breast cancer, ask for a family history, number one. Number two, we should do genetic testing, which I spoke about, like BRCA1, 2, because most men who have breast cancer could probably have the BRCA2 gene. There are two genes, 1 and 2. Male breast cancer is commonly seen in BRCA2 gene. So men can develop breast cancer. It is less than 1% of the total population of women who develop breast cancer. And more commonly, they have a genetic association, and the common gene which is seen in these people is BRCA2.
Doctor, what are all the general screening methods used to detect the breast cancer?
So we have discussed it in earlier live show talks too, that screening is a technique or a test which is used in a general population to identify a disease, and in this case, breast cancer. Okay, so when we are talking about screening, it's a test. It's done in a general population which is apparently normal, like you and me, and you are doing this test to identify a particular disease, in this case, breast cancer, and to identify it early. And you want this test to be effective, it should pick up good number of cases. It should pick up those cases very early, so that when you treat these patients early, your cure rates are very high, and it should have a difference. And obviously, it should be a reliable test. It should be reproducible. Wherever you go in the world, the same test should have value. You cannot say that this test works in India and doesn't work in America. So that is what is a screening test. So there are few cancers in which screening is available. One of the cancers is breast cancer. So the commonest screening method is a test called a mammogram, which is basically an X-ray of the breast. Mammogram is advised in women above the ages of 45 or 50, once a year or once in 2 years. So get yourself a mammogram once a year if you're above 45 or above 50. In the mammogram, you'll have a scoring, which is called a BIRADS scoring from 1 to 6. The lesser the score, the more the chances that it is not cancer. BIRADS 4 is suspicious. BIRADS 5 is or 6 is biopsy proven. So the higher the score, it means there's a high chance that you have a cancer. It is an indicator only. So this mammogram is an indicator. It doesn't say you have cancer. It's an indicator so that this person will undergo a biopsy of that lump or that lesion which is seen on mammogram. If the biopsy comes out as cancer, that patient has cancer. If it doesn't come out, it doesn't have cancer. So mammogram is the commonest screening method. Another common screening tool which we use is an MRI of the breast. But understand, MRI is not done in average women or average risk women or in the general population. So now for that, we have to understand who is an average risk woman. Most women we see, I'm talking about normal women, have an average or fall into the category of average risk. Okay, suppose siblings, parents, mothers, whoever we have who don't have a history, who are normal people, fall under average risk. For these people, mammogram is enough. Women who have a strong family history of breast cancer, women whose relatives have BRCA1 or BRCA2, women who themselves have had breast cancer earlier or ovarian cancer earlier, those women who had radiation to the chest, these people are at high risk of breast cancer. They need annual MRI. So what we should understand is most women in the population are normal, average risk. Mammogram is enough for them. For women who are high risk, that is those who have the gene BRCA1-2 or those who are related to somebody, first degree relative who have the BRCA1-2 gene, or those who have a breast cancer earlier or an ovarian cancer earlier, or who have received radiation to the chest, these are high risk women. MRI is better than mammogram in these people as a screening method to identify the disease early. So that is all we need to know about screening. One last thing which I would add about screening is screening doesn't detect all cancers. 15% of the time, a lump may not be visible on a mammogram, number one. Number two, 15 to 30% of the times, a person may develop a breast cancer in between two mammograms. Imagine I do a mammogram in 2022 and in 2023, 1 year apart. 15% to 30% may develop a breast cancer between their two mammograms, that is between that 1 year period. This is what we should remember. So these women should be educated that, see, your mammogram is normal today, your next mammogram will be after 1 year, but be on guard. It doesn't mean that for the next year, whole year, you will not get cancer. There is no such rule. If you have a suspicious lump, even though you had a normal mammogram, go and consult a doctor, take a medical opinion, even though you had a normal mammogram.
Doctor, in breast cancer, what are all the stages and how the breast cancer is diagnosed? Can you please enlighten us?
So, for understanding the stages, you should understand how the breast cancer starts and spreads. So, breast cancer starts as a lump in the breast. That is the commonest symptom. It can present as bleeding from the nipple. Nipple can go inside. It's called indrawing of the nipple. Or you can have destruction of the nipple. Also, you can have a lump in the armpit. These are the common symptoms. The cancer first starts in the breast, involves the skin of the breast, goes to the lymph nodes in the armpit on the same side, and then, even then, if it is diagnosed late, it spreads to the major organs. The major organs are brain, lung, liver, and bones. So starts in the breast, goes to the nearby lymph nodes, and then spreads to other major organs. Once it spreads to major organs, it is stage 4 or advanced disease. How do we stage breast cancer? If the lump is too small, a chest X-ray and an ultrasound is enough to see if it has spread to other areas. If the lump is bigger in size, or you have lymph nodes in the armpit, many of the times these days, because in India, CT scans or PET scans are so freely available, most patients will undergo a CT scan of just chest, abdomen, and a bone scan for the bones, or a PET CT scan, which does the complete job. This is test which diagnoses where all the disease has spread. Mammogram will tell you if it is suspicious or not, but only a biopsy will tell you if it is cancer or not. So we will do a mammogram first. If there is something suspicious, you will do a needle test called a biopsy. Biopsy does not spread cancer, does not spread breast cancer. Remember that. Without biopsy, you cannot diagnose breast cancer. So you will do a needle test from the breast or from the lymph node or from wherever it has spread. Send it to the lab for analysis. And finally, you will do staging investigation like maybe ultrasound X-ray or CT scan or PET CT scan and bone scan.
Doctor, in general, breast cancer, how many types are there? Are there any difference between the breast cancer to breast cancer?
So what I told you just now is you do a biopsy and you send the tissue to the lab. On the tissue, first, the pathologist will tell me whether it is cancer or not, number one. Number two, he'll tell me the type of breast cancer. So on breast cancer, we look at three things: ER, PR, HER2. E for estrogen, which is a hormone in women, P for progesterone, which is another hormone, and HER2. We look at these three receptors. So today, if you do a biopsy, in 3-4 days, you will get the report. And in another 1-2 days, you will get the IHC. That is called IHC, immunohistochemistry, which is called ER, PR, and HER2. So with these three ER, PR, HER2, you can have different combinations. These are your types of breast cancer. Somebody can be estrogen, ER, PR positive and HER2 negative. That is called hormone receptor positive disease. That's a good disease. Biologically, it's a good disease. Hormone treatment will work in that set of patients. Another extreme is all negative, ER, PR, HER2 negative, which is called triple negative cancer. That's a bad disease. That's an aggressive disease. In this set, you have to give chemotherapy. Then there is another set which is HER2 positive. HER2 positive is those patients who require targeted therapy like trastuzumab. The name of the medicine is trastuzumab. So broadly, you have a good biology, which is hormone positive, HER2 negative. You have bad biology, which is triple negative, and you have a HER2 positive disease. Based on this, you are going to treat your patient either with hormone, with chemo, and with targeted therapy.
Doctor, do this breast cancer spread to the other parts of the body? If yes, what is the pattern generally involved in this spreading?
Yes, breast cancer can spread if detected late. What we should understand is breast cancer is curable if detected early. But if we miss the chance, if a lump is visible, if a lump is felt, and we do not take attention, many women, even today in India, they ignore a lump. They're reluctant, they are shy, they don't even tell their family members, they don't go to a doctor. They lose the chance of curing the disease. If it was such a small lump, they wait, and if it becomes very big, and by the time it spreads, it should have spread internally also. So if you have a lump in the breast, each lump is not breast cancer. There are benign lumps also like fibroadenoma. But if you have a suspicious lump, a fast growing lump, go show yourself to a doctor. They will do tests and they will rule out whether you have cancer or not. By this, you can detect the cancer very early before it spreads. Now, as we discussed, It can spread to the brain, it can spread to the lung, it can spread to the liver, the bone, or other organs.
Doctor, there is a question from one audience. Her name is Rajini. She is asking that if anybody diagnosed with breast cancer in one breast, is there any possibility of spreading it to the other breast?
So there are two things here. Your tumor from here can spread here. That is the same tumor spreading, or you can have a different tumor in the opposite breast. So women who are young, who have cancer, or those who have genetic, like I said, BRCA1, BRCA2, have a high risk for cancers on both the breasts. So yes, technically your disease can spread, the same disease can spread, or you can have a new breast cancer in the opposite breast.
Doctor, there is another question from one more audience, Mr. Raghava. He is asking, I heard my grandmother died of breast cancer very long back, but how frequently my siblings and me are required to take screening?
So what you are going to understand is, we will assume if no test is done, we will assume your grandmother, she would have got, suppose she has got the cancer at a very elderly age, she's an average risk lady. So for an average risk lady, for her family members, you all are average risk. That is, all the women in the family above 45 or 50, as we discussed, you will get a mammogram once a year. Now, only if she was BRCA1 or BRCA2 positive, then you will probably fall into high risk where you will need a more early testing or addition of an MRI. Otherwise, standard for you is like any of us, where an annual mammogram is enough. What we also generally recommend, especially in India, in the West, they say self-breast examination is not of major value, but in our country, where awareness is still not there with regard to cancers, we would urge our women to examine their breast. If you find a suspicious lump, go and seek medical attention. Even after so much, many women don't know about a mammogram. They don't know about screening. They don't know about breast cancer. They don't get a mammogram done. So the easiest way is examine your breast. If you have a suspicious lump, go and show yourself.
Doctor, at the beginning of the session, you said there is one important factor, that is a lifestyle modification, which are in our control to reduce the risk of cancer. Can you please suggest some food habits or whatever that can help us in reducing the risk of breast cancer in women?
So with regard to diet or food, many theories have been postulated. People have said red meat increases breast cancer, increased animal fat increases breast cancer, low fruits and vegetables increases risk of breast cancer, etc. So there is a mixed opinion on this. More importantly, what we usually suggest to our patients is have a balanced diet, a good amount of protein, carbohydrate, minerals, vitamins, fat. Obesity is better to cut down on that. Have an ideal body mass index, do exercise, do whatever you do in the form of yoga or walking or a brisk walk or running to maintain an ideal body weight, eat a healthy food, avoid junk. So these are all the things which will go a very long way, not only in preventing breast cancer or other lifestyle cancers, but also our lifestyle diseases like heart issues, diabetes, hypertension, obesity, knee issues, etc.
Doctor, there is a question from audience. She's Miss Soumya. She's asking, does this breast cancer happen in a younger woman also?
Yes, as I told you, age is a risk factor. Elderly women, the more you age, the more is the risk of getting breast cancer. But in India, we see in India, not also in India, everywhere in the world, you see a lot of women who are young who develop breast cancer. So some may have BRCA1, BRCA2, some may not have BRCA1, BRCA2, but young women with a family history or without a family history have a risk. So unfortunately, there is no screening in such women. Like, you don't advocate mammogram or ultrasound at 30 years or 25 years or whatever. That is why breast self-examination is even more important, especially during pregnancy and lactation. Many a times what happens is during pregnancy and lactation, due to the full breast, if there is a lump, it is mistaken not to be a lump, or due to fullness of the breast, or it is uh, ignored. So breast cancers can occur during lactation and pregnancy. Due to fullness of the breast, it can be ignored. So if you have a suspicious lump, even at that time, again, seek medical attention. Most important, do regular self-breast examination. Clinical breast examination is done by a doctor in the clinic. Even that is advised. There is no formal timeline like they should do it once a year or something, but at least if you have something suspicious, get a clinical breast exam done, and then your doctor will decide if you need a mammogram, etc.
Doctor, there is one more question from Ms. Ramani. She's asking, is there any vaccine to prevent the breast cancer?
No, there is no vaccine to prevent breast cancer, unlike a cervical cancer. So we don't have, it is not caused due to a virus or anything. So there is no vaccine to prevent breast cancer.
Thank you, doctor. There is one more question from the audience. Mr. Raghavendra, he's asking a question. If anybody diagnosed with the breast cancer during the treatment and after the treatment, how is the lifestyle of patient? How it's going to be impact their life in the future?
So please understand, breast cancer is curable if detected early. The cure rates for breast cancer early stages are more than 95%. So whatever treatment you will receive for the short duration of time, the patient will have certain issues, be it due to chemotherapy, be it due to surgery or whatever. But after that, they'll be perfectly normal. And if it is stage 1 or stage 2 or stage 3, the cure rates are going to be excellent. They are going to have a normal lifestyle. Some residual side effects of chemotherapy may be there even after a few years, but otherwise, there's not much to worry. So our focus should be to identify this disease early, to treat it on time, and to have the best possible chance at cure.
Thank you, doctor. Thank you very much for enlightening us on the crucial information that is required for the breast cancer awareness. And if I want to summarize, like changing the lifestyles, that is more important to reduce the risk of breast cancer. And we should not ignore any small lump or any suspicious changes in the breast. That should not be ignored, because as you said, early detection is a crucial point for a better treatment and for a better survival. And you said curability also possible if it is detected early. So I hope this will help us, our viewers, to take care of themselves and report to the doctor if they found anything suspicious. I request all the viewers, if you have any questions related to the breast cancer awareness or information required, so please mention in the chat box. So we will address all your question after this session. And thank you very much for your participation. And Dr. Krishnamani, thank you very much for your initiation to create awareness on cancer, and as well as the Cancer Reach, a great initiative to spread awareness on cancer.
Thank you so much. Thank you so much, and good evening to you all. Thank you.
Thank you, doctor.